Welcome to Business Connection. I'm Liz Spencer. Today I'm joined by Karen Granado. She's the Director of Rehab and Sports Medicine for Edward-Elmhurst Health. Karen, we are sitting here in this beautiful facility. We're at the Edward-Elmhurst Health Rehab and Sports Medicine facility. And tell me a little bit about it.
It's a facility, it's about 10,000 square feet, and we have a multitude of equipment and private treatment rooms that we're able to see our patients in. Rehab and sports medicine includes PT, OT, and speech therapy, so we see, all different kinds of diagnoses from infant feeding problems all the way to, geriatrics, balance and falls and joint replacement, you name it, we see it all here.
How do you differentiate from the many other similar types of business? We see them all over the place. We've all probably had a friend who's had some type of rehab. Yeah. What makes this different?
Well, we like to differentiate ourselves by telling the patients that they're being treated by a licensed professional. We don't have any aides, we don't have any techs. Your one-on-one care with the therapist is a licensed professional who probably has an advanced degree as well. We really encourage our staff to go on with their education, and so we're one-on-one for the entire episode of care, and you're with a licensed professional.
And that's so nice because whether it be an athlete, a stroke victim, someone with a developmental problem or something like that, it's an emotional time for them.
Yeah, we see patients at their most vulnerable period and develop a relationship with them because we want to help them do what they want to do and get them to their max capacity of what their ability is. So it's a lot of coercing, it's a lot of encouragement, it's, bringing them, to the well that, that they may not know is what's there, but it's definitely a challenge, and it's very rewarding for us as therapists to be able to do that.
That's awesome. That's because there is a lot of, whether you be fall victim, there's fear and pain and
always
underlying
sometimes where you don't recognize that it's a fear issue. And once we get you, we break down the task, whether it's because you fell, we can break down the task of walking and kind of identify why you fell, work on those things, challenge your balance, and then be able to get you back so you're more confident in the activity that you had problems with before you came in.
Balance is important to all aspects of rehab, and I'm going to have an opportunity to test mine. All right, so Luke, tell me, what am I doing here? What am I standing at?
So Liz, you're on the Biodex Balance SD, and we use this for both testing and for training for our balance patients. We also use it for our concussion patients. We do a lot of pre and post testing. And so it combines your ability to physically control your body, but also visually control that as well. So this is a limits of stability test. It's a trial of 3, and it measures how well you go from dot to dot, but also how fast you do it. So we'll go ahead and get you set up here. We'll see how you do.
All right. Now, this is about balance. I can talk and balance at the same time. Now, I would think you would be testing me standing on one foot, but balance is so much more. Tell me what balance really is.
Yeah, so when you look at balance, it's really your ability to return to the center, your center of gravity. And so we're always constantly moving. You're moving left, you're moving right, you're moving forward and back, but you know where your center is. And once you've lost the ability to come back to center, you're then at fall risk. Or if you go outside of your comfort zone of that center of gravity, you're at fall risk. And so if you train and you increase the size of your circle, you're at less risk to fall.
Well,
you did pretty good.
I did all right. It's funny because I was listening to you and I'm watching the screen, and I find that I move from one side to the other a little bit better than not. And so
we could work on that.
We could. And I also could see how I could figure out the pattern and help myself too. So
definitely.
Having a little gaming experience works well. Luke, thanks so much for taking time and showing me this great machine. You guys are doing wonderful work here. This was a lot of fun.
Thank you.
And now Talk to me a little bit about outpatient versus inpatient.
Well, inpatient, we like to think of therapy on the continuum. And so inpatient is after a hospitalization, you receive care from an inpatient therapist, and they tend to treat you for the basic needs, being able to get up and get out of bed and being able to dress, being able to walk. That's at the very beginning of your journey. Outpatient is probably towards the end of your journey. There's always stuff that you can do after being discharged from outpatient therapy, but we see people when we're fine-tuning them a lot more than what they did on inpatient or home care or long-term stay facility. We're fine-tuning them in outpatient to make them the best that they can be.
And how do you help them? Because oftentimes when you're the outpatient, you've been here, and then I think it's nice in this campus setting that you have the fitness facility here too. How do you encourage them to continue that?
Yeah, it's all about them, and so we try to get into what is important for them to be able to resume, whether it's golf or whether it's walking without a walker or crutches or a cane. We want them to get back to their max capacity or what they're capable of doing. Sometimes we have to deliver hard messages, but for the most part, I think that we bring them to that elevated level of what they can do. And so it's part of their responsibility is to do a home program. We're very big in giving them things that they can do at home, but then therapy has to end at some point in time, and there's always more that they can do, and that's where the transition to our fitness centers and to personal training or to classes is very valuable, because they can go to see another individual who can bring them to maybe another level that they're not used to. So we definitely refer our patients to our fitness centers, to our personal trainers, so that they can, encourage them to go that extra step and to stay in condition and stay, healthy. It is, our motto to be healthy driven, and rehab definitely lives that tagline.
Every day, I bet.
Every day.
Now, you also have rehab that involves autism and developmental disabilities, which we don't often think about under the rehab umbrella. Tell me about that.
Right. Well, we have a group of therapists who specialize in the treatment of both pediatric and adult disorders for autism and developmental delay. They basically try to teach them to cope or try to desensitize them to different conditions that may be overstimulating to them. And so we put them in environments in an environment that they feel safe in, first of all, and then kind of push the envelope a little bit, challenging them, or like I said, desensitizing them to things that they're very not used to. They build social relationships with these individuals. They challenge, their abilities to walk. They do a ton of different things, and it's a wide spectrum of diagnoses that they do see. But like I said at the very beginning, we treat all ages, from the very young to the geriatric population, and they do it really well here.
That's awesome. Now, you don't have to be a patient at Edward.
No, the only thing that we need is a therapy prescription from the physician. They could be on staff, it could be not on staff. We have 8 different locations within the southwest and west suburban area that they could go to for these services. The Edward campus site is our main hub because we see PT, OT, and speech there. We're also creating a southern hub, I guess you can say, at our Plainfield site, where we're going to have PT, OT, and speech that treats the infants all the way to the adults. So we'll have 2 main campuses that treat PT, OT, speech, and then the other suburban locations will treat PT, primarily orthopedics and neurological conditions.
But your 2 hubs, your main hubs, you're able to get a lot of services all in one. Why is that helpful?
Well, people who are having trouble getting out of the house, let's say post-stroke, they could come for their services for all 3 disciplines at the one site. A lot of facilities don't offer PT, OT, speech all at one site. We do. So sometimes they can come in for their physical therapy services, maybe take a break and then follow up with their speech services. And so they can do it all at one site versus PT here and then 2 days later OT there and another day later there's speech. They have it all at one site and they get to know us and they get to know the staff, and it becomes a family environment.
Well, Karen, that sounds like a great place to leave this interview and say thanks for sharing with us.
Thank you.
I know we're in good hands with you.
Thank you.
Okay, nice to see you.
Nice to see you too.